Medicine was sort of always a part of my life growing up. I was raised by very strong women in healthcare. My mother, she was an interventional cardiologist. Both my aunt and grandmother were nurses. So from a young age, I was drawn to medicine and sort of saw how you can deliver patient care with kindness and compassion. Being in the OR was sort of my happy place. And I found it just so meaningful to, be a part of a patient's journey, stepping in and fixing a problem, and helping them through really difficult moments in their life. And we build patient relationships in two very different settings, kind of the clinic setting where I meet with patients to discuss elective surgery. We have a little bit more time to connect. And then the other sector is seeing a patient in their emergency room, kind of in the hospital when they're coming in with more of an acute problem. When I meet a patient for the first time, I like to spend time even before I see them in the patient room, in the clinic. So I read up on their chart, I look at their other patient visits, get a sense of who they are, why they're coming to see me, just so I go in prepared. I want to focus on what the problem is. They're here to see me. How can I fix it? What are the different options? Do we need to do surgery right away? Do we have time where we can think about it and kind of factor it into their life and when it works best for them? Most commonly, I'm seeing patients a couple weeks after their surgery, checking on their incisions, checking on their pain, making sure they're back to tolerating a diet. Have they returned to work? How can I help them kind of get back to where they need to be within their personal lives and work life? What we do as surgeons that's really unique is we just have to build trust quickly. We talked about seeing patients in the clinic where we have more time to build that relationship, but if you're seeing someone in the ER and it's an urgent situation and you have to build their trust and they have to make a difficult decision very fast. So being someone my patients can trust, guiding them through a really difficult or scary time, for me is actually the most rewarding part. It's as important to me building that trust and connection as the operation itself. So I really value that.